Good morning. We're back again. We had a few technical issues, but now I think we're all set. Today is Saturday, so before, let me do a little your sound check, audio visual check, and our sound check will be, let me see, check, our sound check. So sound is okay, everything is in order. We are ready for the session. So today is Saturday. It's April 1st, 2023 is the April Fool Day. So today's topic is pranayama for chronic low back pain. Last Saturday we presented the asanas for chronic low back pain and also for its acute exacerbation. When the pain becomes so acute, what asanas do you do? Basically, you call a supported forward bend and incorporating your breath. So most important concept here is that the pranayama, which is the fourth limb, is called pranayama. Prana is your life force. Prana is a subtle energy which keeps us awake, alert, and alive. Prana is non-measurable energy. Yam is a control, restraint. When you can control and restrain your life force, the prana, it's a pranayama. Pranayama is not a breathing exercise. It is a voluntary regulated breathing. And you see all the different pranayamas we do. But basically we do, one is called the Bhastrika, bellows, which is the beginning of our pranayama. Then we do a Kapalbhati pranayama, we call it a breath of fire. Bhastrika is called Prano Pradhan pranayama. Prano means prana, the life force. Pradhan means the main. Like it controls and restrains our prana. Kapalbhati word came from, the Kapal is a forehead, Bhati is a shining. It is the exhalation. It is the forced exhalation and passive inhalation. We'll do the practice. This is called your Agni Pradhan Pranayama. That means it ignites our Agni, it ignites our Tejas, and it is very powerful pranayama for called detoxifying pranayama, and it looks like you are glowing. That's called a Kapalbhati, means your forehead is shining. And there's a Anulom Vilom pranayama called alternate nostril breathing, activating both sides of our brain. Then you do a Brahmri pranayama. So it's like a sound like a bumblebee. It's like controlling your five senses. Then the Ujjayi pranayama. It is called your resistive inhalation with the activation of the vagal tone. Shankha pranayama, your resistive exhalation. Sitali pranayama, cooling pranayama, Sitali, Sitkari, Sadanto pranayama. Then you have the Om pranayama, which is your a vibration which is your chanting pranayama, and it's called a Pranabha pranayama. Pranabha pranayama is activating your three components of the Om. So let's start what we do for your chronic low back pain and its exacerbation. So last session we showed it to you that if you have a sudden acute pain which became very serious and severe, you go and you support your forehead. Like here, I'm behind a chair. I'll be going down and put my forehead in a supported position. Do not do unsupported forward bend. Let the hand loose and incorporate a pranayama which is breathing out longer than breathing in. So here I am. I'm totally relaxed. All my body weight is supported on my forehead. I'm feeling a profound level of relaxation in my back. As you know, that whatever the cause of the chronic low back pain was a herniated disc, spinal stenosis, or other condition, but the pain comes from the tightening of the muscles. A relaxation of the muscles removes the pain. So in this posture, I'm breathing out first, removing all the residual air from the lung, slowly taking a deep breath in, breathing out longer than breathing in, without any effort, without any strain. Effortless breathing, you will be able to talk, you will be able to sing. Slowly and slowly you extend your exhalation. Exhalation is parasympathetic. Inhalation is sympathetic. You get a profound relief of the acute back pain from the tightness of the paraspinal muscles, the muscles on both sides of your spine. As I mentioned to you before, that this chronic low back pain is going to stay with you. It is not going to go away, but with a daily practice, you will be able to control the pain, and you will be able to live with this condition. This condition is not going to go away. That is the most important thing you have to remember. And what causes this chronic low back pain? We know all the causes. We know the protections we need, and and what we need to do in an acute low back pain. The two components, the yogic principle in Sanskrit is called Merudanda Acham. That means keep your spine straight. The moment you keep your spine straight, you give a relaxation to the muscles of the back. Remember, my skeleton is going to fall in the front because the head is very heavy. So all the muscles on the side of the spine, called paraspinal muscles, are contracting to keep me straight. So they're always in a state of the tightness, and the pain fibers are all in the muscles and the ligaments. So able to keep your spine straight, you are going to get rid of the pain. And you saw me sit down in this. This is your kneeling stool. When you sit down in a kneeling stool in front of a computer, your spine is straight. You keep your keyboard in this posture. We have a adjustable desk, and then keep the monitor in front of you. So you are going to work in the computer. You are not going to get out. But as long as your spine is straight and able to sit down, you are not going to hurt yourself. Same thing, sitting in a chair. You sit down in a chair, go all the way to the back, keep your spine straight. Same thing you do, standing up, driving your car, whatever you do, spine straight. Then it's called manasthi. Mind has to quiet down. In yogic tradition, mind is the content of your five senses. I hear, I see, I smell, I taste, and I touch. Close your eyes. The moment you close your eyes, which is the most powerful of your five senses, you start quieting down your mind. Eye is the extension of your brain. Brain is covered with the skull, and eye is connected to the brain with a big nerve called an optic nerve. And then eyes is also supplied by another 4 cranial nerves. Next, your hand. Your hand connects your body and mind. The moment you use your hand, like you like something, you say like this. Without even talking, before you talk, your hand gesture, or do like this. Give it to me before you can say, give it to me, please. So touch your index finger and thumb. This is called a Dhyana mudra. Jnana mudra, meditation mudra, put gently over your knees. Now incorporate the voluntary regulated breathing, what is called a pranayama. You are not doing all the fancy name pranayama to start with your voluntary regulated breathing. Wow. Outside we have a serious storm going on. Lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to keep it open like a balloon. The 4.5 liter which you can exchange, called vital capacity. Normal breathing, which is called tidal volume, we breathe only half a liter. So learn how to breathe out first in a yogic tradition. Then slowly take a long breath in without any effort. And breathe out longer than breathing in. If you keep on doing this, your back pain will have a lot of comfort. It may not go away completely, but you will feel able to live with this a nagging back pain. The muscles of breathing are called skeletal muscles, and they can be trained. So if you keep on practicing, a neuroplasticity will set in, and you will be breathing like this all the time, even when you're sleeping. That means your exhalation will be longer than inhalation even sleep. Let's do some practice. If you're practicing with me, let's start first without any effort. Remember, with no effort in breathing means you'll be able to talk, you'll be able to sing. We'll be doing 2 seconds in, 4 seconds out. And remember, the moment you do this, your breathing rate starts to come down. Normal breathing rate is about 15 to 16 per minute. If I'm able to do, which all of you will be able to do, count of 2 in, 1 and 2 in, count of 4 out, 1 and a 2 and a 3 and a 4 out. Six-second cycle. Your breathing rate already came down to 10. We have been doing it for so long, we can do easily 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out. We also can do 10 seconds in, 20 seconds out. So if you're able to do 4 seconds in and 8 seconds out, 12, your breathing rate will be already 5. And we know that when your breathing rate is low, you live longer. Look at the animal world. The animal which breathes faster, like dog, they live very short life. The animal which has a slow breathing, like a turtle, they live hundreds and hundreds of years. So our grandma's joke is that you are born with X number of breaths. If you breathe too fast, quota is over, you have to go. If your breathing rate is low, you live longer. So let's practice. Easily you will be able to do, if you practice, 4 seconds in, 8 seconds out. Let me show it to you. Breathe out first. 4 seconds in. 8 seconds out. It's very easy for us because we have been practicing for a long time. But if you have any effort, you always go back. You can do count of 3 in, count of 6 out. Just let me show it to you one time. We can do easily also count of 8 in, count of 16 out. I'm going to do it silently. Breathe out first, breathe in and breathe out. Breathe out first. Take a deep breath in. It was count of 8 in and count of 16 out. I'm still talking, I'm breathing, I'm totally functional. See, so the most important component of pranayama for chronic low back pain is able to breathe out longer than breathing in throughout the whole day. Even when I sleep, my wife will say, your breathing out is still very longer than breathing in. Then you incorporate next is your Bastrika. Bastrika in yoga in called your pain relieving. Because Bastrika is a prano pradhan pranayama. It brings prana, it does a healing. The prana goes to the organ of healing, like it goes to your back for the back pain relief. Bastrika is called bellows. It's active inhalation, active exhalation. Like in a bellows, you'll be fill it up, and then suddenly you blow them out. So you breathe in and then breathe out. So in a yoga therapy, we do a balance. So let me show it to you. You will do a breathe in here and breathe out here. Then we'll do breathe in here, breathe out here. So do about, say, 10 counts here. Then you can do from here. So what is the basic physiology behind it? Because people who are listening to me, most of them are healthcare provider, you want to know. In a active inhalation and active exhalation, you're blowing away all the carbon dioxide and bringing more oxygen in. It is a simple called aerobic glycolysis. Our end product of metabolism is glucose. Glucose combines with oxygen, which will form carbon dioxide, water, and ATP. ATP is called adenosine triphosphate, which is an energy. If there is not enough oxygen, we produce what is called an anaerobic glycolysis. Here the glucose combines with low oxygen, produces lactic acid, pyruvic acid, pain-producing substance, in addition to carbon dioxide and water. This lactic acid, pyruvic acid, pain-producing substance are the remove those to get rid of pain. And it also causes a prana for the organ of healing. Pain is also due to your vata disorder in Ayurveda. And vata is balanced with the alternate nostril breathing, which will show you very soon. Now you incorporate that active inhalation, active exhalation with the movements. So we did this one. Now we can do raising your hand high up and pulling it down. You can do 3 ways. You can do a slow, you can do a slow speed, middle speed, and a very rapid speed. The way we do it about count of 20 slow, 20 medium, 20 fast is about 60. Then you do a cycle of 60. generally do 3-4 cycles, or we can do one like a medium pace for a little longer time. Let me show you both, and let me show you how you incorporate with your asana practice. Here we'll do very slow, 20. When you pull it down, bring it down with your Adhi Mudra or Balu Mushti Mudra. When you put your thumb inside and close, and hand gets relaxed, that's the way the baby closes their hand. Very powerful too. The 20 in medium pace. Very easy. I'm still talking, I'm still even singing, I'm breathing. There is no effort in my breath. Then we do another 20, very rapid. We also have our health tracker with us, and you can check in our health tracker this is an EKG I'm going to get now, and let's see what my EKG looks like after a 60 cycle of my Bhastrika Pranayama. Remember, we are a physician. We come from the physiological and pathological changes in our body, and these days with this health tracker we can record all it's a beautiful EKG, but there is an increase in the heart rate because of the effort in pranayama practice. Now, you also can continue at a medium pace as long as you can do without any effort. Let me try one time and show it to you how to do it. Just show it to you. I did about 100 of them And with that, I can see my heart rate. The heart rate will go high up, but I'm still breathing. Yes, my heart rate is about 128 now. It is normal because heart and lung is the same organ. So basically, we're also doing a cardiac stress test with this. This is only 100. You could do easily with the practice 200, 300. You can also do this with Adi Mudra, with a rapid movement of your shoulder. Remember, the Bhastrika is an active inhalation, active exhalation. So this, and you do in hundreds and hundreds without uninterrupted. Another thing you can do with the position you have pain. The position you have pain, you go a little short of the pain and then keep doing it, and with this same asana. And do it in a little faster. Remember, faster and slower has no meaning. What is the meaning is the effortless. Yes, we started very slow. We started like this. Deep breath in, out. But we come to the point that we are doing it very rapid. So suppose I have some neck pain and this is the hurting me. So a little short of it, and bring my head a little short of it, or it's hurting here, a little short of it. Let me show you both sides how to do a Bhastrika in different asana position. It's hurting here. So I'm here, little short of pain. Remember, short of pain and with the effortless breathing. And here I'll be doing. And we call it the money back guarantee. We'll give you money back that if the pain doesn't go away. Pain is not going to stay in your body. You do another side. Turn your head on the other side, do the same thing. I'm doing 100 counts each time. I've already done 300 counts. Okay? Most of the people with the back pain also have a knee pain. I have a serious problem with my right knee. It is swollen, painful, but I've shown to the orthopedic surgeon there is no growth, any bone joints. It is, I have what is called a patellofemoral arthritis. It is little arthritic changes between the kneecap called patella and the So what you can do, you can slowly sit down, put your feet in a Gururasana, eagle pose. Take your right foot over there, slowly wrap it around and sit down in a eagle pose, Gururasana. Hands in your Adhimudra, sitting down gently, or you can put it here, wherever is comfortable. Remember, most of them are comfortable. Then you do the same thing again. Bhastrika Pranayama. With 400 of them, no effort, nothing, and very comfortable, because the pain is from tightness of the ligaments and the muscles. It is a relaxation. Then with the Bhastrika Pranayama, you are washing away all of your pain producing substances. This is the therapy for chronic low back pain and acute. Even in the acute back pain, you do it, will go away. Same way to the balance, you do another Gururasana eagle pose with the opposite foot and opposite knee. Now my left one goes behind the right. I'm sitting here. Many of the time we even sit down here in a chair and keep it this way. Your knee joint starts to get relaxed and the pain will go away. Again, Adhimudra. $500 of this. No effort, nothing. Speed has no meaning. It's all in effortless breathing. Also can do your sit-ups with your Bhastrika Pranayama. So if you can do that, this will be a wonderful practice. Let me show it to you. So you will be doing sit-ups, but you will incorporate your Bhastrika Pranayama. Okay. Hand is the prayer pose. You are breathing out first. Take a deep breath in and going down, you breathe out. We have done an effort, 20 of them. Let's take a look. What is the current heart rate? 130. So it's almost 85% of my maximum heart rate. This is a cardiac stress test. Wonderful practice. Bhastrika is the gateway of your pranayama, and Bhastrika is the pain relieving pranayama. This is like your, what pain medication do you take? Motrin, Aleve, aspirin. So we are checking our parameters and our breath. 3 components. No pain. Should not be doing any asanas pranayama with a pain. Next, you should no effort in breathing. It's already, see, we're very activating our parasympathetic tone, so heart rate is already coming down to your this is a very important concept, even less than 90 now. So it will slowly come down to baseline around 60. How fast it comes down is very important. That's your parasympathetic activation. Next one is a Kapalbhati Pranayama. You have a balloon here, diaphragm here, another balloon here. You push your belly button to the back, it hits your diaphragm, it hits your lung, all the air comes out, called active exhalation. And there is no inhalation. Because you don't have to learn inhalation. The day you are born, you take a deep breath in. You learn how to breathe out. We do this Kapalbhati Pranayama with the mudras. With about 10 mudras, touching index finger and thumb. This quiet down your pitta. It is your Gano Mudra or Dhana Mudra. Index finger down, put it down, it's called a Vayu Mudra. It controls your vata, controls your pain. Middle finger and thumb, Shunya Mudra. It is improves your hearing. Ring finger and thumb, Prithvi Mudra. It controls your kapha, your obesity, especially truncal obesity, diabetes. Varun Mudra, touch your little finger and thumb, the water component, it controls your bladder function, the water content of your skin, and other kapha related disorder. Ring finger and little finger and thumb, Shakti Mudra, it's called a strength. Today you wake up, you don't have much strength, you do with the Shakti Mudra. Middle finger, ring finger and thumb, Apna Mudra, Pashan Mudra, digestive Mudra. It should digest all of your undigested toxic material called amas. Index finger down, Apna Vayu Mudra, called a Hriday Mudra, good for heart and lung. Generally, we do going up and down in the step or any cardiac work, we do with the Hriday Mudra. Linga Mudra, hold your hand and thumb up. It is to improve the phlegmas which comes out, and the children do it very often. You can do a Ganesh mudra, the remover of obstacles. So you have about 10 mudras. We do 50 of this Kapalbhati Pranayama with a 10, about 500 of them. I can show you, just for the time's sake, the time is going fast, there's about 20 in each, and show you how you do with every mudras and what it does. Spine straight, then push, bring your awareness to belly button, push the belly button in, air will come out. You can check it in, you can put your one hand here if you're new to it, put a hand under your nose, so I did all exhalation without any inhalation. What inhalation? I did in between without knowing. Consciously I did exhalation, and inhalation was subconscious. A lot of people come and say, I cannot do it. I cannot do it. It's very simple. Can you cough? Yes, it's coughing in front of me. Now cough with your mouth closed. My mouth is closed, I'm coughing. It's a Kapalbhati Pranayama. It also massages all the internal organs. So let's start a practice with 20 each. Dhanu Mudra or Gyanu Mudra. 20 counts, and I will explain to you what he's doing. Vayu Mudra. You understand the concept. Let's do about 10 each, and I'll tell you, I'll explain. So you'll do with the mudras and as much as you can. It massages all the internal organs. Massages your liver. Massages your stomach. Massages your spleen. Massages your pancreas. Massages your colon. Massages your small intestine, massages your kidney. For the women, it massages your uterus, in your tubes, ovaries, massages your bladder. For the men, massages your prostate. Change the mudra, Shunya Mudra. When you massage your organs, it improves the function of that organ. Prithvi Mudra. It also massages your diaphragm. Above the diaphragm, you have a lung on both sides. It massages your lung. Varun Mudra controls your bladder function and the blood flow of your skin. In between the lung, you have heart. It massages your heart from underneath. Massaging your heart improves your heart function. Even if you do a CPR, when you do a chest compression, cardiopulmonary resuscitation, what you are doing, you are massaging your heart. Here you are doing massaging your heart from inside. So this is called an internal CPR. I change the mudra to Shakti Mudra. Even when somebody comes with a cardiac arrest, if you come to emergency room, they're not responding, we used to do a left thoracotomy, open the chest on the left side, we used to hold the heart and then pump. And also see, I have some saliva in my mouth. My mouth is very wet now. That means I have a parasympathetic activation. I'm talking to you for a long, long time. I don't have any water, nothing. My mouth is very wet. Apna Mudra. All the high in the blood, high cholesterol, high sugar, high uric acid, those are toxic substances of undigested food. Our food gets digested with our Agni, called Jathar Agni, the digestive fire. When the food is properly digested, all the toxins being digested, they're called Ama, and all the high contents in your blood comes down. Hriday Mudra. Linga Mudra. Sit down in a chair, sit down in the ground, keep your spine straight with the 10 mudras, do Kapalbhati Pranayama. Then we do call it breath holding. The first breath holding we do is your breath holding in inhalation, Abhantarin Kumbhak. And then we incorporate our chin lock. We put the chin down, touch your chest. Chin lock is called Jalandhar Bandha. It stimulates or massages your carotid sinuses. Carotid sinus massage quiets down your cardiovascular system and nervous system. It is also a wonderful relaxation practice so that your back pain, tightness of the muscle goes away. Touch your index finger and thumb, putting over your knees. Breathe out first. Take a deep breath in. Hold your breath. Drop your chin down, touch your chin to the chest. Keep counting how long you can hold. It is a vagal activation and profound relaxation response. You hold your breath, lung is slowly expanding because the air is not coming out. When it comes to at the end, your rib cage is not allowing the lungs, so the pleural surface has a vagal nerve fibers. Start a reflex called the Herring-Brewer reflex. It starts receding your lung, so lung slowly comes back. We're starting from, and you get a profound vagal activation. It is so relaxing. This is called a Murcha Pranayama. Murcha means almost unconscious. You become unconscious. Breath holding in exhalation, called your abdominal lock. And also called a Uddiyani Bandh. Breathe out first. Able to see here. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. We do about 3 to 5 in every session, and it's a wonderful practice for relieving your pain. Remember, when you practice like this, pain will be afraid to come and stay in your body. You can move your abdominal wall, Agni Kriya, and then massage your internal organs. We do this about maybe four times, about 10 of each, 7 to 10 of each every day. Same concept, breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and move. What you practice, huh? You can use all the 3 locks of bandhas, and you call it Mahabandh. You will do a abdominal lock, Udyani Bandh, then you do a chin lock or Jalandhar Bandh, then you contract your pelvic muscles and push your tightness or anal canal and pull it up. It's called a Bula Bandh, it's called a Mahabandh. Breathe out first. Take a deep breath in. Completely breathe out and suck your stomach in. So Mahabandh. This is a metabolic pranayama. It is also Agni Pradhan pranayama. And once the Agni gets ignited, there is about 40 kinds of Agni in our body, the pain gets relieved. Alternate nostril breathing, Anulom Vilom pranayama. It's called Vayu Pradhan pranayama. It balances your Vata. Vata is the cause of your pain. So alternate nostril breathing is the remover of your pain. Dhyana Mudra, Jnana Mudra on the left side. Close your right nostril. You don't have to push all the way down, just underneath your nostril. Breathe out through your left nostril first. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. activates your both sides of your brain. Now continue doing alternate nostril breathing, and I'll tell you the benefit. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. So left nostril breathing is called a Chandra Nari, moon energy. Right nostril is controlled by the left brain. Left brain is analytical, it is male, it is heating, it is sympathetic. So right nostril breathing is called your Suranari, sun energy. It activates both sides of your brain and a powerful tool for relieving all the pain. Also improve the memory, and also very powerful tool for hypertension and Alzheimer's disease. Next, what you can do, you can get more concentration. Bring your concentration in your third eye. Put your index finger and middle finger, and then the alternate nostril breathing. And also you can incorporate what is called the super brain yoga to bring the balance on the left hand or the right earlobe. Remember, when you hold both the earlobe and sit up and down, you do your super brain yoga. Now continue alternate nostril breathing like this. How long you do alternate nostril breathing? You continue until you have an effort in breathing. So for a daily practice, we do about 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation, and generally in our practice we do about 5 to 10 minutes of alternate nostril breathing. These three basic pranayama, Bhastrika, Kapalbhati, and alternate nostril breathing, Anulom Vilom Pranayama, is our daily practice. Then you incorporate breath holding, Nadi Shuddhi Pranayama, and the Bhramri Pranayama, Ujjayi Pranayama. We do other chanting pranayamas like a Om Pranayam, Pranabho Pranayam, and we also do alternate nostril breathing without closing our nose, which is called a meditative pranayama. We'll be practicing those next Saturday, when we'll be practicing a meditation for the chronic low back pain. Now incorporate breath holding with alternate nostril breathing, which is your Nadi Shuddhi Pranayama. Take your hand, bring your index finger and middle finger down, and make a pinch with your little finger, ring finger and thumb, Vishnu Mudra. Hands in your Dhyana Mudra, Jnana Mudra, put it over your nostril. It is a ratio of 1:4:2. Like it will be 4 seconds in, 16 seconds hold, 8 seconds out. And slowly you can increase it in the same ratio, 5 seconds in, 20 seconds hold, 10 seconds out. Let me show you your cycles so you will understand it very well. And if you want to do it with me, you can practice. Close your right nostril, breathe out through your left nostril. Breathe in through your left nostril at the count of 4. Hold your breath for count of 16. Breathe out through right nostril with the count of 8. Breathe out through your right nostril. Breathe in through the right nostril with the count of 5. Hold your breath for count of 20. Breathe out to the left nostril with a count of 10. By practice, you can do longer and longer. You're able to do 6 seconds in, 24 hold, 12 out. Keep the ratio of 1:4:2. You also can do a Savitri Pranayama. Savitri Pranayama is also 1:2 is to 2:1. And whatever you do like a, say, 4 second, 4, count of 4 in, count of 8 hold. Count of 8 out, then count of 8 hold again. What is called inhalation. Puraka. The breath holding is called your Abhantarin Kumbhak. Kumbhak is a breath holding in inhalation is called retention. Breathing out is exhalation, is called Recha, and breath holding in exhalation is called your Bajya Kumbhak, what we call suspension. So it's very simple. This is called Savitri Pranayama. Breathe out first. Okay, breathe in with a count of 4 in. Hold your breath for count of 8. Breathe out with a count of 8. Hold your breath for count of 8. Same ratio, you can just keep on increasing. Do 5, hold breath for 5. Breathe out for, hold for 10, breathe out for 10, hold for 10. For your chronic low back pain, it's a wonderful tool. It's called your Brahmari Pranayama, bumblebee breathing. We have 5 senses. Shut down our 5 senses, then we create a vibration. We create a vibration which is a frequency. Is a simple principle of physics. 2 frequencies interacts called harmonic resonance, cancels each other, mind quiets down, and the pain literally goes away. We can do a lot of way, but Shanmukhi Mudra, but let's put your index finger in the forehead, use your 3 fingers to close your eyes, use your thumb to close your ear, and close your mouth. You're shutting down your senses. You breathe out first, and you will take a deep breath in and breathe out with the sound of a bumblebee. We'll do about 2-3 times. For you, if you're practicing, see the effect of it. Breathe out first. Take a deep breath in. more time. Breathe out first. Relaxation, you're pumming and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in the hand, if you're wearing glasses, remove your glasses. Take both the hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand. The heat relaxes your muscles in the eyes, relaxes your ciliary muscles, which is contracting to make the lens less convex. Relaxation will make it more convex, and it helps in your reading. Massage your forehead, massages your eyes, massage your face. All the muscles here attached to the skin, but the muscles are relaxed, all the lines will go away. All the frowning line goes away, all the lines here goes away. Go behind the ear, massage the ear, massage your earlobe, massage the external auditory canal. There is a branch called auricular branch of vagus nerve. Come back your hand, massage your side of your neck. It is called your carotid sinus. It also causes a vagal activation. Take your hands back, massage at the tubercle, sternomastoid muscle, trapezius muscle, which is a wonderful relaxation technique. Use a shankha pranayama, blowing a conch shell, which is called a resistive exhalation. So use your hand is like a adhimudra, thumb inside and closed, put your one on the top. You generally don't do breathing in through your mouth, you all do the breathing through your nose. Because when you breathe in and out through your nose, and we'll show you the next time during meditation practice, how the whole nasal breathing quiets down your mind. If you breathe in through your mouth, the air can go into the lung, your stomach, you don't know where it has gone, but you always can breathe out through your mouth. That is more physiological. So breathe out first. Take a deep breath in. Breathe out against the resistance like a conch shell. One more time, breathe out first. Deep breath in. We do all this set of pranayama daily. I mean, here we're taking time because you're talking, you're explaining, we're doing it slowly. When you sit down at one place and keep doing, it goes pretty fast, you know. So it is not the time. Time is not an issue. Initially, you find time for yoga. Then the yoga finds time for you. Sitali pranayama or sitkari pranayama. As you know that we don't breathe through our mouth, but we can do this to cool down. Sitali means cooling, with your mouth breathing. Technique is, you breathe out first, you put your tongue out, roll your tongue, breathe in through a rolled tongue and breathe out through your nose, like this. Roll your tongue out, Breathe in, close your mouth, breathe out through your nostril. Within a short time, your whole inside gets cooled down. Your pitta balances. Always, you know, vata pushing pitta. When pitta gets balanced, vata is also get balanced. If you cannot stick your tongue out, you can put your tongue high up and breathe through your teeth. Sitkari pranayama. Wonderful technique. We'll finish with the Ujjayi Pranayam, and Ujjayi Pranayam with Jalandhar Bandh with a left nostril breathing. It's called Chandravedi Pranayam. In a Ujjayi Pranayama, you slowly constrict your larynx. Larynx is supplied by two nerves, superior and inferior laryngeal nerve, which is part of your vagus nerve. When you slowly can relax way, constrict the larynx, you activate the vagus nerve. The input called afferent signal goes into the brainstem, and the efferent, the exit, comes out to the glossopharyngeal nerve. Glossopharyngeal nerve supplies your soft palate, palatopharyngeus and palatoglossus muscle. It tightens up the soft palate. It really helps not to have any snoring. That also comes out the hypoglossal nerve, which supplies your tongue. It pushes the tongue in front. So it's a powerful tool for your sleep apnea. So I'll do one slow Ujjayi Pranayama, then we'll do incorporate Ujjayi Pranayama with your chin lock, Jalandhar Bandh, and left nostril breathing, call your Chandravedi Pranayama for profound relaxation and in getting rid of the pain. Normally we do slowly close the larynx and breathe in and out, and you call the sound, ocean sound, or a dart feather sound. You can do a more tighter and tighter constriction without any effort. So when you have effort, you will see accessory muscles of respiration will be active. Here, they are not going to be active. Like this. It is so relaxing. It incorporates your abdominal lock, Uddiyani Bandh. It also massages your thyroid gland. So let's finish with the Ujjayi Pranayama. And you can also practice sitting down, slowly closing your larynx and breathing in. When you get a little cough, is entirely normal. A cough comes from the larynx. In fact, when you get a cough, that means you are constricting the right place. They're to the most relaxing, meditative pranayama. Breathe out first. cannot have a better practice than this. By the time you're able to do this, your whole mind, the software, all the bugs will be removed from the software. You will never get any more software updates. And software will be controlling your hardware, the body, and all the pain, all the symptoms will go away from your body. Let me show it to one more time so that you can catch it well before we finish. Next Saturday we'll be doing the meditation for your chronic low back pain. Adhi Mudra. Breathe out first. Take a deep breath in. Completely breathe out. Wonderful practice. Thank you for joining. Cannot have a better session than this, and there's a lot of information on this video for you to look at it again for your future reference and practice. Any question, comments, put it down in the Facebook, and we'll be glad to do it for you. Answer for you. Okay? And what else? Okay? We'll come back next Saturday for another session, meditation for chronic low back pain.